Have you ever wondered how anesthesia works? What happens when that mask goes over your face or that IV starts to drip? Today we unravel the mystery behind one of modern medicine's most pivotal discoveries. Anesthesia, the state of controlled temporary loss of sensation or awareness, is a medical marvel that allows doctors to perform intricate procedures without causing discomfort or distress to the patient. But how exactly does it work? To understand this, it's essential to first grasp the concept of consciousness. Consciousness is a complex interplay of various parts of the brain, each contributing to our awareness and sensation. Anesthesia works by interrupting this interplay, essentially putting the brain on pause. The most common types of anesthesia, general and local, work in slightly different ways. General anesthesia, often administered through inhalation or intravenously, affects the entire body. It induces a deep sleep, blocks pain, and paralyzes muscles. In the case of general anesthesia, the anesthetic drugs work by binding to receptors in the brain and spinal cord. These receptors are protein molecules found on the surface of nerve cells. They receive signals from other cells that can either trigger or inhibit a nerve impulse. Anesthetic drugs inhibit these impulses, effectively turning down the volume on the sensory information that the brain receives. This interruption of signal transmission is what causes the loss of sensation or consciousness. While the exact mechanisms are still not fully understood, researchers believe that anesthetic drugs likely affect multiple sites in the brain and spinal cord. They interfere with the transmission of inhibitory and excitatory signals, which control consciousness and pain perception. On the other hand, local anesthesia numbs a specific area of the body. It's like hitting the mute button on the nerve pathways between a particular part of the body and the brain. The person stays awake but feels no pain in the numbed area. Local anesthetics, meanwhile, work at the site of the drug administration. They block the sodium channels on nerve cells, preventing the nerves from transmitting signals to the brain. Thus, even though the procedure might cause tissue damage, the brain doesn't receive the signal, and therefore no pain is felt. Now, it's crucial to note that anesthesia isn't a one-size-fits-all solution. An anesthesiologist, a specialist doctor, tailors the type and dose of anesthesia to each individual patient. Factors such as age, weight, medical history, and the type of surgery all play a role in this decision. Wrapping up, anesthesia works by disrupting the communication between different parts of the brain or between a specific part of the body and the brain. It does so by binding to receptors in the central nervous system or blocking sodium channels on nerve cells, effectively muting the signals of pain or awareness. But remember, the field of anesthesiology, like all of medicine, is continually evolving. Researchers are always seeking to understand more fully how these drugs work, to make surgeries safer and recovery periods shorter. So the next time you find yourself counting backward from 10 in an operating room, you can rest easy knowing that the marvel of anesthesia is hard at work, making sure you feel no pain. And that, friends, is the magic and science of anesthesia.